Good morning. I am Stephen Crowley from the Hypertension Scientific Sessions 2025, and we have just enjoyed a wonderful talk from Dr. Rangaswami from George Washington University on the use of combination therapies for cardiovascular kidney metabolic syndromes, and we are gathered here to discuss with her some of the key takeaway points from her talk.
Thank you so much, Steve. It was a pleasure to be here and talk about such an exciting time that we live in. And personally, for me as a nephrologist, it's truly a home run. When we just, had a chance to discuss combination therapies and how they have the ability to revolutionize and impact, what seemed like a very adverse forecast for cardiovascular and, adverse kidney outcomes. I think that's truly what got me interested. When you're a nephrology fellow, you're, thinking about so many interesting aspects of kidney physiology and interactions, and, the world is full of possibilities. Once you go into practice, and I realized this very early, the outcomes did not match any of the excitement during training. And what I ended up seeing was not a lot of beautiful physiology, but a lot of patients just crash landing into dialysis, patients with kidney disease with whom I had developed such meaningful relationships over time, just dying out of nowhere. And then when we look at the data, it makes sense. And just as I, had mentioned, if you have this combination of people with type 2 diabetes and kidney disease, 90% of them will die or have a cardiovascular event before they even get to the point of kidney failure. And I think as a nephrologist, it becomes deeply personal. And it was very clear that there was this huge unmet need to optimize heart as well as kidney outcomes. And in the past few years, we've just seen this explosion of the therapeutic armamentarium that we have at our disposal. And now it's really a call to action. And how do we just bring all of this home? And how do we deliver it in an appropriate and also an equitable fashion to our patients?
Which leads us to our next question for you. And I know it's impossible to answer this briefly. It's a huge field. But if you were to give our listeners one or two key points in terms of the current state of translation with combination therapies, what would you tell them? What would you tell your patients? The take-home message for how they can apply what you've learned.
Yeah. I think the first point that I make even today, every day in clinic, is that there is hope. I think previously a diagnosis, and certainly for kidney disease, was almost we did what we could, we put them on available therapies, and yet watch patients decline or die. We now know that, whether we treat early and even if we end up missing opportunities and treat later, we still have the ability to manage and stabilize both heart as well as kidney disease. And I think that can happen not just for individuals in our clinics, but at a population health level. And I think to that end, the American Heart Association's Cardiovascular-Kidney-Metabolic Health Initiative is so important and timely because it offers an implementation framework on how to approach these interconnected factors, metabolic conditions, heart disease, and kidney disease, and think about it from a mechanisms perspective and all this interplay that we know and so much knowledge is growing. But how do we then take therapies that have multi-organ benefits and how do we implement them amidst all the existing barriers in health systems? So I really think that the highlight of what I think today is there's hope, there are opportunities, and this is the time to act.
Thank you. And then our final question is during your talk, I thought one of the most helpful elements of your talk was to raise a long list of questions that we have not answered. And I know we can't list all of those, but I was wondering if you might, for our listeners, just describe what you think some of the key next steps will be in terms of understanding the use of combination therapies in this setting.
You're right. And I think it's really interesting that on the one hand, we can keep up with data, like today we think, oh, I have a grasp of combinations, and tomorrow another trial's going to report, and then it's going to change the calculus all over again. But on the other hand, I think one of the key areas for scientific development is the translational aspect. We have kind of been in this interesting scenario, and this is from the SGLT2 inhibitor story onwards, of kind of putting, the cart before the horse. And then after all these overwhelmingly positive trials, we're now trying to race to understand how these exactly work, where mechanisms of therapies overlap, and where they are distinct. And that is important to understand many unanswered questions and important questions that will inform future trials and future implementation. The other big area is, I think, while we have the American Heart Association CKM framework, when you look at the reality on the ground, there are huge disparities and huge inequities. How do we take therapies that are clearly expensive, that in high-risk individuals, especially underrepresented communities where many of these therapies are disproportionately underutilized, and how do we equitably deliver therapies in a risk-appropriate way? So I really think a lot of future work is going to look at those questions.
Wonderful. Well, Dr. Rangaswami, we cannot thank you enough for such a meaningful contribution to the hypertension scientific sessions this year. So thank you so very much.
Thank you so much for having me.